In this lesson, what I want to do is talk about anaesthetics. And it's important that before we discuss the kind of discovery of anaesthetics and the discovery of these kinds of drugs, we should really talk about what an anaesthetic is. Now, an anaesthetic is effectively any kind of drug or medicine that induces a state of anesthesia. So, anesthesia. Okay. Now, the question you're going to be asking now is, what is anesthesia? And anesthesia is effectively a kind of state of loss of sensation. It means loss of sensation. So, loss of sensation. And it's generally within a medical setting that the phrase anesthesia is used. And this really came about as a result of one of the biggest problems that we still have at this period of time in the 1800s when it comes to surgery. And this is the problem of pain. Because any kind of surgery, invasive or even non-invasive, is going to bring about and cause a lot of pain to people. Now, this, the resultant problem of that is it causes a number of issues, okay? And really the big problem is, how do we deal with pain? How can we reduce pain? Reduce pain while also maintaining the effectiveness of a surgery, okay? And the main kind of drug and medicines and sort of medicinal responses to pain within surgery were natural drugs, things like alcohol. Okay, alcohol dampens pain receptors, as well as opium. Opium is generally a more effective one, which is why we still use, in today's medicine, we still use variations of opiums and opioids, things like morphine. Okay, these have been used for a very long time. However, the most preferred kind of drug is a drug that basically brings about a state of anesthesia, an anaesthetic. And so we've got a few examples. So we've got a few examples of. If I can just get this back to normal, there we go. So we have a few examples in a general timeline of the different kinds of innovations and discoveries that were made around anaesthetics, okay, from 1799 to 1847. The first really is Humphrey Davy, who identified nitrous oxide, okay, as a possible pain relief, and this was in 1799. So as early as 1799, we have tests of different kinds of chemical compounds to try and work out if there is any kind of way in which pain can be relieved, and the potential medicinal uses for these drugs. And then we're going to jump 46 years to 1845, okay, and it was used more and more in the field of dentistry. This is nitrous oxide. So we start to see now the use of nitrous oxide into the mid 1800s, using in fields of medicine, specifically dentistry. And then in 1842, slightly before that, okay, we have Crawford Long, who discovered the anaesthetic qualities of ether. Okay, however, it should be noted that his work was never published. And then in 1847, we have James Simpson, who discovers the effect of chloroform. Chloroform being a very effective anaesthetic today. Okay, and this is one of the things that we start to see tests and to find more useful anaesthetics for childbirth. So we can see that there is a development in anaesthetics during this period of time, the development in painkillers specifically. However, we have to note as well that one of the effects of this wasn't actually a reduction in successful surgeries, but actually an increase in surgery. And this is, correlated with an increase in the death rate. And this is because when you have an unconscious patient, okay, they are easier to operate on. It takes, and therefore you can take your time. so they took longer to operate on. When you've got somebody who is in pain, who is not under any kind of anesthesia, then it's very, very difficult to perform operations on. This was reduced when we have painkillers and people who are unconscious. And so therefore, surgeons decided to take the liberty of performing longer surgeries. They could take their time, okay? But then the problem with this is longer operations led to higher death rates. This can be from a number of reasons, okay? The first one that you can note is that of blood loss. Blood loss. Okay, and then the main one that we can talk about is that from infection. And this brings us into another issue that we have during this period of time as well. So we have an increase in infections due to the fact that surgeons didn't really operate with very hygienic methods. Okay, and this effectively increased the death rate because it increased infections that were taking place. And compounded with this is the fact that the surgeons were taking longer, which means that they had the longer the operation, the more exposure these parts of the bodies have to these unhygienic environments, and therefore compounding the issue of increased death rates. So the discovery of different kinds of compounds and chemicals, things like nitrous oxide, ether and chloroform, had a very positive aspect in the way that in which it reduced pain, okay, and it made surgery a lot easier to perform. However, it also led to an increase in the death rates due to general complacency when it comes to surgery, because surgeons feel like they can take longer to operate on unconscious patients, as well as compounded with the unhygienic methods that were going on at the time, which led to further infections. In the next lesson we're going to do is look at the introduction of antiseptics within the medical community.